Well, 4 Catholic nuns have died of COVID-19 and 17 others tested positive at a convent in Mthatha. Mother House Convent also serves as an old age home. According to a statement from the Congregation of Precious Blood Sisters, the upsurge of COVID-19 at the convent began with the infection of a sister who works as a nurse at St. Mary's Hospital and who is presently regarded as the prime source. She was placed in quarantine on the 2nd of June. Other members of the community were also discovered to be infected, resulting in 4 of them, all of them elderly, succumbing to the virus last week. It has been discovered that more sisters are infected, young and old. Presently, 17 have tested positive, 15 are negative, and 3 are still waiting for the results of the test. All right, well, for more on the story, we're now joined by Bishop Sithembele Sipuka of the diocese of Mthatha. A very good afternoon to you, Bishop. Thank you for joining us on SABC News.
Good afternoon, and thank you for having me here.
Well, Bishop, this must be a very difficult time then for the church. 4 nuns have now passed away due to the virus. Has this particular convent where all of this happened now perhaps been closed, for purposes of maybe cleaning, sanitizing, all of that, so that other nuns, staff, and other elderly people there don't contract the virus?
Yes, we are still looking at that because this has caught us by surprise. That place is a mother house of all the sisters, and so you have a lot of sisters there in that convent, and it's easy to find a place to transfer them. So we are still looking at that possibility so that the place is fumigated.
Take us through the series of events where we now find ourselves in this situation. We understand that, a nursing sister at St. Mary's Hospital, who was, of course, a nurse there, is regarded as the primary source. And, of course, now there's fears about the hospital staff as well, possibly contracting coronavirus. Can you just take us through the series of events? I do understand it's a shock at the moment, and the fact that you're telling us that it caught you by surprise, but I'm sure you can take us through, what happened.
Yes, there's a lot of shock there because it's a very vulnerable place in 2 ways, because it is the headquarters of the sisters, where the other convents are served from. So it means now it's totally locked down, as it were. Everything is stopped. The sisters who are the branches of that convent are not served because, including the leadership that stays there, it is infected. Number 2, it's also an old age home, which makes it very vulnerable with old people with underlying chronic diseases. So everybody is distraught, really. There is only the faith, that is keeping them going. Right now we are struggling to get, people to even to cook and to clean there, because for now we have put all the infected sisters, in one wing, and they are just there. They are not doing anything, and some of them were doing certain chores in the house, and nobody's doing that because we have sent all the workers home. So we're looking now at the possibility of eventually evacuating them. But while they are there, we're also looking at ways of taking care of them, that they eat at least, and that the place is clean. So it has really taken us all by surprise, and has changed life, completely.
Are there any ideas, Bishop, to perhaps involve the Eastern Cape Health Department, to involve the government? Because, what you have on your hands now is really actually a crisis. I mean, there must be, of course, those sort of concerns of it spreading even more, as we know that, nuns are generally, in contact with other people, whether it is the sick and so forth. So clearly this is now, some kind of a crisis. Is there a need maybe perhaps on this platform then to reach out to the Eastern Cape Health Department, to government to come in to assist? Because, we can't have a situation where the elderly and the nuns remain in this convent, regardless of the fact that it is the headquarters of the sisters. I mean, clearly they need to be taken out of there.
Sure. No, that's a good thought. When you are caught into something, that you did not expect, you're caught in it by surprise. You deal with the immediate thing of emotions, and practicalities.
Yeah.
Because even the results have been coming in drips and drabs, As I say, there are still 3 more whose results have not come. In order for us to determine the whole situation, what is the way forward. And I think what you are sharing with me, it's a good thought. Now that we are sort of settling with the situation, now we know exactly what it is, and then we can see what we can do in terms of seeking assistance.
All right.
I must say though that from the health department here in Mthatha, we're getting a lot of support.
Okay.
The health official, are often there, with us. But obviously they are only dealing with health-related issues. They are not dealing, with the daily provision, of the sisters and their work. Yeah.
All right. Bishop, thank you for your time, and all the best in terms of having to deal with such a situation. Thank you, though, for agreeing to speak to us here on SABC News.
Okay, good. Thank you very much. Bye-bye.
That's Bishop Sithembele Sipuka of the Diocese of Mthatha in the Eastern Cape, where, of course, they're faced with a huge crisis on their hands, where a convent and nunnery, the headquarters of the nuns, at this point, the Mother House, as it's called, we found that nuns have tested positive, and in fact, at this time, 4 now having passed away due to coronavirus, and indeed a call there by the bishop, seeking help, of course, indeed, from the government, which is what this platform here on SABC News is certainly for. So hopefully, indeed, it's getting to the right ears, and certainly to help those nuns in need of help, and elderly people really in the Eastern Cape.